World Health Organization just declared this a global health emergency.
At least 6 states banning large gatherings of people.
This is what the healthcare workers have resorted to. They're wearing garbage bags.
They decided to evacuate 78 of its residents and move them someplace new.
The COVID-19 pandemic and an increasing number of natural disasters show how devastating emergencies can be to nursing home residents. Nursing homes present unique challenges to first responders, as many residents have neurological impairments that can make crisis situations especially confusing and stressful for them. This stress can result in resistance and disruptive behaviors that can be difficult for both resident and first responders.
This video training series is designed to prepare crisis responders to provide compassionate crisis care, to reduce challenging behaviors during emergencies and disasters when every minute counts. In this video, our focus is on crisis intervention techniques for emergency responders.
At least 95% of nursing home residents have behaviors that may be challenging due to neurological or psychiatric disorders, including dementias, mental illnesses, and mild cognitive impairment. In addition, are residents suffering behavioral complications from strokes, traumatic brain injuries, and intellectual disabilities. These impairments can lead to agitation and challenging behaviors that can be difficult to manage, even for EMS providers with medical experience. In this video, we'll learn more about these challenging behaviors as well as some positive interaction techniques that can help avoid or diffuse them. These techniques are rooted in patient-centered care, which is an approach that focuses less on pharmacological restraints and instead on understanding the resident's point of view and then individualizing care to respond to their unique emotional and social needs. Let's look at how challenging behaviors can emerge during a natural disaster. A lightning strike has knocked out power in a nursing home. Their nursing home staff may not be aware of their emergency plans and things are chaotic. You're told by command that this is a shelter-in-place situation. Firefighters and EMS providers are assigned to go room to room to help make sure all residents are safe and accounted for.
Oh my gosh, I'm so glad you're here. The lights are out, the power's out, I don't know what's happening. I need to check on the residents, I don't know what's going on.
Yes, ma'am. We got reports of a lightning strike. We're gonna go check things out now, okay?
Yes, please, thank you so much.
Command Engine 7, please have all residents shelter in place.
Roger that, residents shelter in place.
Fire department. Fire department. Miss Smith? Miss Smith? We're going around making sure everyone's safe right now. Are you okay? Are you having trouble breathing?
No! Help! No! Help! Stay away from me! Stay away!
Neurological impairments can change the way residents perceive their environment, distort their visual and auditory processing, reduce their ability to make sense of what's happening, or to make their needs known. Just imagine how disconcerting it would be for a resident with dementia to suddenly hear loud noises and see lights flashing, and a stranger in full firefighting gear in their personal space.
From a person-centered care perspective, challenging behaviors are more than problems to be dealt with and suppressed, but rather important clues that can help the caregiver perceive what may be going on in the mind of the resident. It is the resident's way of communicating stress, confusion, or feeling threatened. And we need to try and understand what the resident is trying to communicate and communicate back with calm, non-threatening care that helps diffuse the agitation and confusion the resident is experiencing.
Disruption to routines, new faces, and irregular procedures are especially difficult for residents with neurological impairments. Understand that you may need to spend more time and take a more gentle approach with these residents to avoid disruptive behaviors. Use the following positive interaction techniques to build trust, minimize confusion for the resident, and help you accomplish your work more effectively. Reduce stimulations like noise or bright lights. Use non-threatening body language and facial expressions. Communicate face-to-face and at the resident's eye level. Use a calm tone of voice. Communicate simply, clearly, and not too quickly. A resident may need time to absorb what you are saying and make sense of it. Give the resident time to respond. If available, ask a regular staff person or a trusted family member to be present. Their presence and knowledge of the resident can help avert many disruptions. If that's not possible, an EMS partner can provide a comforting presence to the resident while you perform your evaluation and care for the resident. Let's see how these positive interaction techniques can improve our emergency situation.
Hey, Mrs. Smith. I'm Jackson. This is John. We're at the fire department. We're here to check you out. Are you okay?
Stay away from me.
Here, it's just you. That's all it is. Now let's help you, okay? We're gonna come over here and sit down, okay? Let me get your hand. Nice and easy. Alright, in and out.
Let's look at another situation where a hurricane has triggered flooding in the area and nursing home residents need to evacuate to a higher floor. Changes in a resident's environment and routine can trigger agitation. If you notice agitation, such as pacing, gently approach the resident with non-threatening body language and facial expressions. Reassure them with a calm tone of voice. Gently redirect the resident's attention to a different activity. Encourage your crew to utilize diversion items that engage residents' hands, such as fidgets, magazines, or items to hold. Let's see how these techniques can help in this situation.
Hello, fire department. Hey, man. I know it sounds really scary outside. Is it alright if we get you to someplace that's a little safer?
I want it to stop. Make it stop.
Well, is it alright if we take you upstairs? Someplace that's a little quieter? Okay, maybe we take your stuffed animal with you? I don't know. Okay. All right, well, here, let's get you upstairs.
It is also important to remember that not all behaviors are challenging or problematic. For example, a resident's pacing or exploring may be a frustration to staff, but not a challenging behavior if the resident is not at risk or putting others at risk. Also, be aware of the signs and the symptoms of someone who is escalating towards aggression or about to have a break. These signs can include pacing, removing clothing, particular types of staring, changes in cognition, changes in the ability to articulate verbally, mood changes, as well as other signs listed on screen.
Let's look at another emergency situation where EMS providers need to transport a resident with a traumatic brain injury and sudden chest pains to the hospital.
Hi, good morning. We're here for patient Nolan. Yeah. We were called for chest pain. I see that he has a TBI. Is there anything else we should know?
Yes, he may not react the way you would expect, so it's important that you talk softly to him. He also could put up a fight, just be aware of that.
Okay.
All right, thank you.
Got it.
You're welcome.
Yes.
Follow me this way.
When gathering medical information on your patient, it is important to ask the nursing staff about any neurological conditions or triggers that may lead to challenging behaviors or heightened emotional responses. This information may not be noted in the patient's medical record, but will help you provide safe and effective patient care.
Nolan, we're taking him to the hospital.
Where are we going?
Hey, Nolan, can you calm down for me?
In this situation, the resident has become physically aggressive and may pose a safety risk to the EMS provider and themselves. Block any blows. Never hit back at a resident. Step out of reach and remain calm. Don't take verbal abuse personally. Use calming communication techniques. Redirect attention. If you are not able to diffuse aggressive behavior, notify a nursing home supervisor immediately.
So the ambulance reminds him of the accident when he hurt his head. It would help him if he could sit all the way up so he can see where he's going.
Hey, Nolan, I'm gonna sit you all the way up, okay?
Here, is that better, honey? Thank you.
You're welcome.
You can also get help from caregivers or family members if available. Families can provide important information about triggers, past traumas, and ways to diffuse challenging behaviors. Having a family member or caregiver accompany the resident in the ambulance is often the best way to proceed.
When transferring the resident at the receiving facility, make sure to document in your care report any challenging behaviors and effective calming interventions. Share this information verbally with staff so that the patient can receive appropriate care from the start.
We hope this training helps crisis responders provide care that is effective and preserves the dignity of residents. For more information, please log on to the website on your screen.